Charlie is active, full of life and love, the outdoors, but soon a cancerous tumor is spotted on his liver and eventually will spread out through his organs, through his entire body, causing him to lose the ability to do things like take walks around the neighborhood, play ball with family, and even feed himself, and control his bladder and bowels. Charlie and his family are told that there is nothing else doctors can do for him, and he will die. They come to the decision that it is best that Charlie not have to suffer through needless pain anymore, so they will say their goodbyes, and Charlie's life is compassionately ended. I know you were not expecting a picture of a dog, but my point here is that in surveys conducted by Harris Institute in 2011 and by the American Veteran Association of America in 2013, 9 out of 10 families consider their pets as members of the family, the same as grandma and grandpa, and even children. Why do, as Americans, show more compassion for our pets who are dying than our fellow human beings? Why do we give animals the option to end their pain when they are terminally ill, but not to our loved ones? At one time, women were not even allowed to vote. Alcohol consumption was illegal, and many other things were not as normal as they are today. So who is to say that it will finally become legal for terminally ill patients to have the right to choose to end their pain and suffering at the time and place of their choosing? In the end, death is tangible, optional for those who are suffering and do not see life as an option any longer. But we must see it from the inhumane and religiously wrong. But we must see it from the eyes of the patient. With legal guidelines and patient rights to choose and access physicians-assisted death, prevent loss and their autonomy, limits pain and suffering from controlled, needless medical costs. We are promised rights in this country, and the right to die should be up there with the right to live. First, let's start with what the definitions of legal guidelines of physician-assisted death. Physician-assisted death is defined by, according to the website of the American Medical Association, death is the voluntary termination of one's own life by administration of a lethal substance with the direct or indirect assistance of a physician. Physician-assisted death is the practice of providing a competent patient with a prescription for medication for the patient who use with the primary intentions of ending his or her own life. Currently, there are 4 states in the United States that have physician-assisted suicide laws in place. Oregon was the first place to pass a law allowing doctors to help their terminally ill patients live lives. With the 1997 Death with Dignity Act, Washington was the second state to follow in 2008, with Measures number 1000, also known as the Washington Death with Dignity Act. Oregon and Washington Acts are both have the same requirements for qualifications of physician-assisted suicides. The first requirement is that the patient is an adult, so they have to be over the age of 18. Second, they have to be competent. This requires that the patient's physician and psychiatrist or the court have the option that the patient can make informed decisions in their own health care. Third, the patient must have a terminally ill and confirmed by their physician. Fourth, they must voluntarily express that they would like medication to end their life. Fifth, they must also make a written request for medication that will help end their life, so to being tracked by the state governments. Finally, they must meet requirements of citizenship for that state. All of these requirements must be met in order to qualify. They do not meet qualifications solely on age or disability, as the statutes do require that the doctor recommend counseling, have them notified of a family member, and inform them of the risks and probable results, as well as feasible alternatives. Now that we have talked about the guidelines that are well established, let's move on to values of patients having the right to assisted physician death. According to the Oregon Division of Public Health website in April of 2013, report to date in regards to the data pertaining to patients according accession physician assisted death, the number one reason given why they want it is because the loss of independency. This was 91%. In Jill Leperio's article, Charles Mayo of the Mayo Clinic Institute, that people have much right to die as they have right to live. Lives might end up inflicting a short or torturous, some feared, not letting terminally ill patients have the right to die goes against the freedom promised here in America. Every person in this country has rights. A right to speech, learn, love, laugh, so on. So they should have a right to die as well. If a terminally ill person wants to avoid excruciating pain and wants to end their life in a dignified manner, it is implied in the concept of ordered liberty, the right to exercise a patient's right to die is something one can choose for themselves, and the court should have much a say in this matter as they do in the matter of such as marriage, family, relationship, procreation, and the refusal of termination of life, saving medical treatment. We are to live in a free country where we can make our own decisions, but we are really free. But are we really free if we cannot even make the choice to live or die on our own terms? The second reason is the right we all is because it can help shorten the time of pain and suffering terminally ill patients will have to endure. Dr. Mary Ingalls, a Harvard medical professor and lecturer, states in an interview in the Wall Street Journal in 2010, says, lying in our hospital today are people afflicted with excruciating pain and terminal conditions, and diseases that have left them permanently incapable of functioning in a dignified human fashion. They can only look forward to lives filled with yet more suffering, degradation, and deterrence. When much people beg for a merciful end to their pain and indignity, it is cruel and inhumane to refuse their pleas. Compassion demands that we comply and cooperate. And finally, we come to the cost of dying. In a report done by 60 Minutes titled The Cost of Dying, it is reported that an average cost per day to stay in the ICU is $10,000. And most terminally ill patients will spend anywhere between 8 days and 2 months in the ICU. At the end of their lives, while doctors do everything possible to prolong life, often only in efforts because the family members of the patient are not ready or willing to acknowledge the fact that the patient is indeed dying. The total cost is between $80,000 and $600,000. In conclusion, death is a tangible option for those who are suffering and do not want to see life as an option any longer. Many see it as inhumane and religiously wrong. But we must see it from the eyes of the patient. With legal guidelines, a patient's right to choose and access physician-assisted death prevents loss of the autonomy, limits pain and suffering from controlled needless medical cost. We are promised rights in this country, and the right to die should be right up there with the right to live. You may remember Charlie the dog, whom I opened my speech with. In this picture, a woman is wearing a shirt that reads, "Let me die like a dog." I leave you with this quote by Socrates: "Death is not the greatest of evil. It is worse to want to die and not be able to." Thank you.